So you were saying the context for the community mental health services is quite different there.
Yeah, Australia has the main focus of mental health care in Australia is on community. We do most of our care and treatment for people in the community, and inpatient services are seen very much as a short-term acute admission when community resources just aren't able to support the person in that environment. And it's very much the model that Australia's been progressively working towards over the past 20 or 30 years. In Bahrain, their focus is much more the reverse. It's much more on institutional care. So, for example, they have 276 nurses working in mental health. They have one mental health institution in Bahrain, and out of those 276, 7 of them work in the community. 6 are clinicians and 1 is a supervisor. So you can see that I think it works out. It was certainly less than 5% of their nurses are involved in community care. So and that differs significantly here on a number of levels. And one is that because we have more clinicians per person in the community, they're able to provide much more intensive care. Now, our system's not perfect, but they're able to provide care in relation to medications, in relation to physical health, etc. But they can also look at people's goals in life. They can help people to reconnect with the community, to make the best of the skills that they have. We certainly try to work towards a strengths-based model where consumers of mental health services are encouraged to look at what their strengths are and what they're good at and how they can build on those, rather than just a system where it's looking at what's wrong with people and what they need to make them better. But because Bahrain currently have 300 clients that they see, 6 clinicians that work in teams, so 3 teams of 2, then they're not able to provide that level of care. They usually see somewhere between 10 and 20 patients in any one day. They have distances to travel, even though it's a small country. It's one centralised service, so there's still a fair degree of travelling involved. So their visits would generally be somewhere between about 15, 20 minutes often, and it's a matter of giving medication, just making sure people are okay. There's no opportunity to really look at helping the person or their family live with the mental illness to the same degree that we're able to do here in Australia.
And you were saying there are some opportunities in the longer term?
They're very interested in developing a specialist course in community mental health nursing, because they're aware that they don't have that level of expertise yet. The nurses working in the community have basically been working in the institutions and have then moved into that new role without educational preparation. And they're very interested in working collaboratively with CQ University to develop a specialist community mental health program that would be, the way we envisage it at the moment, it would be taught physically taught in Bahrain, but that there would be support coming from CQ University, both in terms of academic and clinical expertise, and also the capacity to award at a master's level. And those are discussions, obviously, that we still need to have, but that level of interest is there.